Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features. The clinical features are in a renal cell carcinoma, there is a triad. The triad of renal cell carcinoma is you will see presence of gross hematuria is seen first, and there is abdominal pain, abdominal mass, and abdominal pain is also seen. This abdominal mass and abdominal pain, or this uh, classical triad, is actually seen in only 10% of the patients. This classical triad is seen only in 10% of the patients because it is seen in late cases only. But if you were asked, there are three things. One, we have gross hematuria, we have abdominal mass and abdominal pain. Out of these three things, if you were asked what is the most common presentation is obviously it is hematuria. The patient will also have other symptoms like fever, weight loss, malaise can be there. So other symptoms like fever, weight loss, malaise, there can be acute and non-reducing varicocele is seen. Then because of inferior vena cava obstruction, lower limb edema is seen. Now why is there inferior vena cava obstruction? This is because the renal tumor, the tumor from the renal kidney, it spreads into the renal vein, and from there it reaches the inferior vena cava and causes blockade in the inferior vena cava. Because of this obstruction of the inferior vena cava, the blood which is in the lower limbs, it cannot be drained. So as a result, there is accumulation and lower limbs, resulting in lower limb edema.
thank you and thank you for watching.